All right, we're going to clear our call screen, and I am asking for you to call if Obamacare has already adversely affected you. Because apparently the Republican National Committee and the rest of them, while they run around raising money, they don't know how to do this, so I'll educate them. And this isn't any kind of concoction on my part or fiction on my part. You folks out there who've been adversely affected by Obamacare, patients, policyholders, employees, employers, individuals who've had their health care drop, their premiums go up, doctors who are retiring or going to retire, doctors who have horror stories, nurses, hospital administrators, insurance agents, and you got to be concise. I mean, rather than sit here and say they ought to do this, they ought to do that, I'm going to do it. So just give us a call. You have to get through Mr. Call Screener. You got to be concise because there's going to be a lot of you. But all this crap about how wonderful this damn program is, even before it's implemented, it's going to cover millions and millions of people. Yes, it's dropping millions and millions of people from the health care they like. Now, I want to remind you of what our great president said, who is in fact a serial liar. I want to remind you what he said about Obamacare. And I want to also tell you today he made two public statements about this, a 10-minute speech, also a comment in front of his cabinet, and he wouldn't take a single question. No questions, because that's the way imperial presidents are. Number 7, Mr. Producer. Here's Obama, May 11th, 2009, cut 7, go.
But I'm also committed to ensuring that whatever plan we design upholds 3 basic principles. First, the rising costs of health care must be brought down.
Lie.
Second, Americans must have the freedom to keep whatever doctor and health care plan they have.
Lie.
Or to choose a new doctor or health care plan if they want it.
Lie.
And third, all Americans must have quality, affordable health care.
Lie again. 4 lies in 2 sentences. Here's Obama, August 15, 2009, cut 8, go.
No matter what you've heard, if you like your doctor or health care plan, you can keep it.
Lie.
If you don't have insurance, you'll finally be able to afford
Lie.
insurance. And everyone will have the security and stability that's missing today.
Lie. Obama, March 23, 2010, cut 9, go.
If you like your current insurance, you will keep your current insurance. No government takeover. Nobody's changing what you've got if you're happy with it.
Bald face lies. Cut 10, Obama, September 10, 2009. Go.
If you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor.
Liar.
Let me repeat this. Nothing in our plan requires you to change what you have.
Now you know why I call him a serial liar. Obama, February 19, 2008, cut 11, go.
And if you already have health insurance, we will lower your premiums by $2,500 per
Lie.
family per year. And if you can't afford it, we will subsidize your care, and we will emphasize prevention so we have a health care system instead of a disease care system.
Lie. Obama, December 16, 2009, cut 12, go.
If we don't pass it, here's the guarantee. Your premiums will go up. Your employers are going to load up more costs on you. Potentially, they're going to drop your coverage because they just can't afford an increase of 25, 30% in terms of the cost of providing health care to employees each and every year.
Yes, they can now.
And the federal government will go bankrupt because Medicare and Medicaid are on a trajectory that are unsustainable.
Stop. What has Obama done about Medicare and Medicaid? Medicaid, he's massively expanded, and Medicare, he's undoing. Go.
This actually provides us the best chance of starting to bend the cost curve on the government expenditures of Medicare and Medicaid. So anybody who says that they are concerned about the deficit, concerned about debt, concerned about loading up taxes on future generations, you have to be supportive of this health care bill, because if you don't do this, Nobody.
All right, lies. Now, cut 13, Obama, April 13, 2011. Go.
Our approach lowers the government's health care bills by reducing the cost of health care itself. Already the reforms we passed in the health care law will reduce our deficit by $1 trillion.
Absolute flat-out lie. I've got the statistics right here. If I have time, I'm going to get to them. Obama, September 10, 2009, cut 14, go.
The plan will not add to our deficit. The middle class will realize greater security, not higher taxes. And if we are able to slow the growth of health care costs by just 0.1% each year.
All right, and you didn't.
%. It will actually reduce the deficit by...
Cut 15, Obama, March 3, 2010, go.
My proposal would bring down the cost of health care for millions. Families, businesses, and the federal government. Our cost-cutting measures mirror most of the proposals.
That's enough. Now, folks, he lied repeatedly about Obamacare, just as today he lied repeatedly about his own role in the debt, in yearly deficits, in conspiring with Harry Reid to make sure we don't have budgets. Obama's willing to say anything because that's what he was taught. That's what he was taught by Davis, by Ayers, by Wright, Saul Alinsky's readings, and so forth. Say whatever you have to say, particularly with the Praetorian media in this country, which stands there and guards you, protects you from the truth. Now I want you to hear some of the truth, ladies and gentlemen. Greg, Fort Myers, Florida, the great WFSX. What is Obamacare doing to you? Go.
Well, Mark, my wife and I spent the last 15 years building a medical transcription company, and we had it up to 132 employees. And within months of that bill being signed, we're down to 5. So 15 years of hard work is just down the drain.
And how did Obamacare do that?
Well, there's a system. They want to connect all of the hospital records together. So they, the way I understand it is, they didn't tell them they had to use the system, but if they didn't use it, they wouldn't get Medicare and Medicaid reimbursements. So hospitals all across the nation spent hundreds of millions of dollars implementing this new system, and it took away the medical transcription, put tens of thousands of people out of work. And from what I understand, it's not working the way they wanted it to. Doctors hate it, hospitals hate it.
And what is medical transcription, briefly? I'm sorry.
Well, that's where a doctor, when he examines you, he dictates into a recorder, and then he has somebody transcribe it.
And keeps the records to himself in his office for possible sharing if you need a specialist or you're in the hospital, but not some part of a federal database.
Right.
All right.
It was supposed to be a federal database, but that's not working. I mean, it could have been with the system they had. Everything was on computers anyway. They just needed to tie them together. But I don't know.
So 127 people have lost their jobs in your business, your small business, as a result of this.
Yes, sir. Yeah.
All right. Thank you for your call, sir. I'm sorry. Robin, Concord, California, the great KSFO. What has Obamacare done to you? Go.
I got my notice on Saturday from Blue Shield. My premiums for the next year are going up $2,000. Not only that, my plan was canceled. They're putting me on a different plan. All I wanted was catastrophic insurance. Next year I will have to pay almost $6,200. I'm a single woman. I'm self-employed, and I carry my own insurance. And as of next month, I'm going to have to cancel it.
Isn't it amazing? The government has destroyed what was perfectly fine for you.
Exactly, Mark. I will never again be able to save for retirement. I will never again be able to do any major maintenance on my home. They're destroying my life, Mark.
All right, Robin, I'm very sorry. And they don't give a crap either. Brian, Reading, Pennsylvania, Sirius Satellite, what has Obamacare done to you?
Hey there, Mark. I help run a grocery store up there, and I'll tell you what, all of our employees' hours have gotten cut below 28 hours. And, these are people that depend on our job to support their families, and now people are getting 2 to 3 jobs, performance issues, and employee morale is entirely too low. We're running into issues with high turnover because people aren't getting the hours. Now we have to hire more employees, and you're seeing hours cut down to 16, 17 hours a week, so it's not even worth their time. And, it puts a huge, huge stress on management to try and cover those positions and try to get even people hours to, make them happy to stay.
Isn't it amazing? And meanwhile, all the propagandists dressed up as journalists all over television and radio talking about millions of people will now have health care when, in fact, people are losing their jobs, full-time jobs to part-time, losing jobs, losing their health care benefits. I mean, the media propaganda, which is trying to hold up Obama, is unbelievable, is it not?
Oh, look, I absolutely agree with you. I mean, a lot of these people are people with no kind of, business reality where they look at things and say, well, you know what, this is for the better, nothing's going to happen. But, us who are trying to run stores, run businesses, see it as such a destructive policy. And what do we tell our employees? They don't want to believe that, Obama and his great administration are doing this. They want to look at the corporation now and say, oh, well, you know what, they just don't want us to get the hours. They don't want to pay us. And that's entirely not the fact. But none of them want to look into it and know the truth.
All right, Brian, thank you for your call. I'm sorry to hear this. Heather, Wisconsin, Sirius Satellite, go.
We're self-employed farmers, and I have a husband and 2 young children. Our premiums since the Affordable Care Act have gone up 100% per month, and our deductible has gone up 50%.
Mm-hmm.
That's it.
And why? Why? Because, the government's stepping in between you and your policies, driving up costs. Do you know what's actually going on here, Heather, and nobody's talking about it? This is a major scam. This is about redistributing wealth. And so money is being taken from you and these other folks who are calling, whether they're small business people, the other lady who called, the single woman who called. It's being taken from you. It's being laundered through the federal government, laundered through state exchanges, and going to somebody else.
I've had my policy for so long, I actually received a letter from the insurance company saying some of the rules for Obamacare won't apply to your policy, so you should feel lucky. But in the meantime, they still jacked it up 100%.
Mm-hmm.
So I don't know whether that's
Heather.
good or bad. I still don't know what's all going to happen. But
here's the thing. The people who passed this damn law, and the man who signed it, and the jerk on the Supreme Court who rewrote the Constitution, they don't know. They have no idea. This is how tyranny works. This isn't a constitutional republic. Thank you for your call, Heather. This is a disgrace, and we actually have people in Congress right now defending this, and they don't even know what the hell they're defending, except for the fact it takes decision-making away from you and screws up your life and gives it to them. That much they know. The question is, for those of you who care to share your views and call the program, and we have a full board, but keep them coming. The question is, what has Obamacare done to you as a patient or a doctor or some other type of provider, as a nurse, as a consumer generally, employee, employer, union, non-union? I can tell you right now, CNN and MSNBC, I don't even think Fox, have cameras out there across the country asking people what a disaster this is. And folks are all over the place who are being ruined by this. And I mean ruined. It's all over. It's right in front of your face. But somehow the cameras can't find you.